Her co-workers called it the death shift. Inside the pediatric ICU of a Texas hospital, terrified whispers spread every time nurse Genene Jones clocked in. Babies who were stable, some even improving, would suddenly stop breathing, seize, or die without explanation. Parents trusted her. Doctors praised her. But behind that nurse's uniform hid one of the most chilling killers in American medical history. In the early 1980s, San Antonio's Bexar County Hospital became the hunting ground for a woman who was supposed to save lives, but instead, took them. Genene Jones, later known as the Angel of Death, was a licensed vocational nurse working with the sickest children in Texas. On her shifts, death was a regular visitor. At first, colleagues believed she was simply unlucky. But the odds told another story. Infants were 10 times more likely to die when Jones was on duty. What no one knew was that Jones carried a syringe filled with death. Using hospital drugs like succinylcholine, a powerful muscle relaxant that stops breathing, and heparin, which causes fatal bleeding, she secretly induced medical crises in her tiny patients. Some experts believe she was suffering from Munchausen syndrome by proxy, a disorder that drives caregivers to harm their patients in order to appear heroic when saving them. But Jones's interventions were rarely about saving. For many children, her syringe meant only one outcome: death. Her crimes went unnoticed for years. When suspicions finally surfaced, the hospital made a fatal decision. Instead of reporting her, they quietly forced her resignation and destroyed evidence to protect their reputation. Freed from scrutiny, she continued to kill. In 1982, in a small Texas clinic, Jones injected 15-month-old Chelsea McClellan during a routine visit. The healthy toddler died within minutes. Her autopsy revealed the same deadly drug. Jones was convicted in 1984 for Chelsea's murder and another child's injury, earning a 99-year sentence. But Texas law at the time granted good behavior credits that drastically shortened prison terms even for murderers. Decades later, families were horrified to learn that Jones would be automatically released in 2018. The race for justice reignited. Prosecutors reopened cold cases, unearthing new evidence that linked Jones to dozens of other infant deaths. American Crime Cases IN 2017, just months before her release, she was indicted for 5 new murders. Facing overwhelming proof, the now 69-year-old Jones pleaded guilty in 2020 to killing 11-month-old Joshua Sawyer and received a life sentence. Families finally saw the woman who stole their children admit her crimes. The true number of victims may never be known, some say as many as 60. Hospitals protected their image while parents buried their babies. Genene Jones betrayed everything the nursing profession stands for, turning compassion into cruelty and care into carnage. If you believe in justice, truth, and stories that expose the darkest corners of humanity, don't forget to subscribe.